You're watching the Microsoft US Health and Life Sciences Confessions of Health Geeks podcast, a show that offers industry insight from the health geeks and data freaks of the US Health and Life Sciences industry team. I'm your host, Claire Bonacy. As a part of the ongoing Year of the Nurse and Midwife series, Kathleen McGrow, our Chief Nursing Information Officer, will talk about the month of March as Colorectal Cancer Awareness Month. We'll talk about how to overcome barriers to screening, alternative screening methods for the future, and why Kathleen is such an advocate for this cause. Enjoy the show. Thanks for joining, Kathleen.
Hi, Claire. How are you?
Doing good. So I know March is Colorectal Cancer Awareness Month, and we do have a lot to unpack and talk about. So Kathleen, since you are a passionate advocate for colon cancer screening, do you mind telling us a little bit about that and why?
Sure. Thanks for having me, Claire. I really appreciate it. For National Colon Cancer Awareness Month, which, as you know, is the month of March, I wanted to talk to you and send the message out to folks to be proactive and for people to get their colonoscopies when due, which used to be at age 50 and has since 2018 been changed by the American Cancer Society, lowered its recommended screening to start at age 45.
So what made you decide to get tested at age 50?
So at age 50, I thought, I just wanted to be proactive. I'm a nurse. I like to try to make sure that I do what I need to do within my healthcare regimen. So I just went ahead. I scheduled my routine colonoscopy. I had my first colonoscopy right around age 50. It was actually at my 50th birth month. And they had some findings that were positive, which was kind of a surprise for me. I do not have any family history of colon cancer in my family. And when my doctor phoned me the first time, it was just to say that I had questionable pathology and he was going to send it out for further testing.
Wow. Okay. Well, thanks so much for sharing. So can you tell a little bit more about that process and anyone you know that has also gone through something similar?
Sure, absolutely. So like I said, this was purely a check the box item for me. And I figured, I wouldn't have to have it, for 10 years. I do not have any family history of colon cancer. I was really surprised when I got the "you have cancer" call. And not only that, you have two different types of cancer. So apparently these can be started something that you don't even know about. I was asymptomatic. I didn't have any problems or any issues. And so through routine colonoscopy, just screening, they actually found something that really could have been life-threatening and detrimental to me. I actually do know of friends that, have waited till they're in their later 50s and have been diagnosed with, stage 3 and stage 4 cancers, which, as you know, are much more difficult to treat. And my provider told me if I had waited another 2 or 3 years, I would have been much farther along and not had the good results that I had based on the types of cancers that I had.
Wow, that does really show the importance of just the education, the patient education that you had to know that to go get screened and just kind of, what you have to do. So you've been cancer-free for 4 years now. That's amazing. Can you tell us a little bit about what advancements you're seeing in testing or diagnosis and the care pathway with this?
Sure. What I'm getting to here is that I felt fine. I was just getting a routine check. And I know for a lot of people, it's really scary to think about the testing that you have to go through and the preparation for a colonoscopy, especially. So I think that there are other things that will be coming along. Technology will be a game changer. I think if you had just even a blood test that you could do that could potentially identify a cancer that you may have, and then kind of move on to the next steps of what you might need diagnostically, it really would make a big difference, and it would make it much more pleasant and more convenient for the patients.
Yeah, and you've mentioned a little bit in the past of some of the testing that you can do in home and then send out and get at least a little bit of results to determine if you need to get a screening.
That is correct. There are tests that they can actually send them to your home. I do not qualify for them now because I have had cancer, but for someone going in at 45 for a routine screening, they could actually do tests at home, mail it back in, and then they'll get the results. And like I said, I do think that there are organizations that are working on other testing that can be done to kind of take the heavy lift of having the prep and the colonoscopy. You have to take 2 days off of work for the one for the prep and one for the procedure. And I think people really think about that. So that kind of is a deterrent for them. But I must say that it's really worth your time because you want to maintain yourself and be healthy. And it's better to know earlier than to not know until too late.
Yeah, that's very true. Definitely the barriers to care are a huge issue. And obviously, patients need to work with their doctor for finding options that fit their routine, their personal preference, and comfort level. So I know that there's also a lot of genetic testing going on in the market right now. Do you feel that this is relevant in this space?
Yes, as a matter of fact, I do. I actually had genetic testing done. I was in a study at a Sharp University or Sharp Memorial in the late 2000s, late 2000, like 7 or 8. And when I went back and looked at my genetic screening at the time, I actually tested at high risk for colon carcinoma. And I remember looking at my tests when I got them back at that time. I didn't pick up on that, and I really didn't even think anything about that. So obviously there was something there that I should have probably paid attention to. So I'm very grateful that at least being proactive and going during my, birth year for that, age 50 was so important that I tried to be proactive.
Yeah, that's very true. So what do you want to leave listeners with as we close out?
I think that, I just wanted to tell my story. I'm totally clear now, but I highly advocate screenings, and I try to advocate when I talk to people and they tell me, most people say I'm afraid or it takes too much time. So I try to tell them my story. My hope is one day is that we'll be able to have other options versus going through an entire prep and procedure. Something that maybe fits within folks' routine or their personal preference and comfort level. I think doctors can guide you, but ultimately you need to be proactive and advocate for the option that suits you best. And this will empower you as a person and as a patient. So I think working with healthcare professionals, we can kind of overcome some of the barriers to screening and improve access to colonoscopies and alternative screening methods. I'd say my final message is please be proactive with your health. Get your colonoscopy when due. Don't put it off or delay. It could save your life.
Great. Well, thank you so much, Kathleen. I'm so glad you're cancer-free now, and I'm so happy that you're on the team and you're such an advocate for this. So thank you for talking to us today.
Thanks, Claire.
Thank you all for watching. For more information and resources on colorectal cancer, visit the Colorectal Cancer Alliance website at www.ccalliance.org. We look forward to continuing the Year of the Nurse series next month with episode 3. Please feel free to leave us questions or comments below, and check back soon for more content from the HLS industry team.